Okay, so just a little bit of brief story about myself. So I went to American University of Antigua, which is actually a Caribbean school in Antigua for my medical school, and but I was actually raised in the U.S. Parents are from India, Gujarat, and I was actually born in England. So I pretty much did most of my studies here, and but was not able to get into a U.S. medical school, so I took the Caribbean route, and it was a challenge in the beginning. You had to get used to the different, the island, for example. But the education, I think my education was really strong. I was able to learn so many different various diseases on the island, and also, they adapted the U.S. system as well, so I was able to, work with that as well. But then eventually, I was able to get into the residency of my choice. I actually applied to, I would say I applied to my two top, which was family medicine and also and pathology, and I got into pathology. So I think that was a success. But it did come with a lot of struggle. You had to work hard. You had to kind of follow the right guidance and so forth, because whenever you start medical school, you really don't know what you're doing. And also, I'm not sure if someone has done previous education, it's completely different than what you've done before. So let's get started, and let's kind of understand the typical medical school outline that you need to definitely understand. So typically in the United States, what we do is we do 4 years of undergraduate education. And typically we do, like, for example, for myself, I did a degree in biology. But it depends. It depends on where you go. If you go to a Caribbean medical school, they don't really require 4 years. So if I had known that before, depending on what program I get into, it's really important to know that do they really want 4 years? Do they just want 2 years? Do they just want your pre-med courses? So and then typically take an MCAT test. So I did take an MCAT test, but for the Caribbean school I went to, they didn't require it at that time. So I could have saved on that as well. So what I really want to focus also on is the first 2 years of medical school. And I'm going to kind of get into that, how to actually succeed in the first 2 years and how to actually use your resources really well. But after the first 2 years, you typically should take the USMLE Step 1. And USMLE Step 1, I would say, is probably the most important exam out of all of them, because that's what they look at whenever you apply to residency. So you want to really focus on that exam, and you want to have a plan of action for that exam. And I'll kind of get into that in a little bit. And then you do your third year, which you typically do clinical rotations, depending on, you typically do your normal rotations like internal medicine, family medicine, pediatrics, OB, psychiatry, and surgery. You typically do those, and then you also do electives on what you want to do. And one thing that I recommend is, let's say if you want to go into pathology, for example, or if you want to go into internal medicine, start focusing on those type of rotations. But you probably won't know until I would say the first after your first part of your third year, because maybe because you want to try out different things. But if you know early, go and start doing that, because that's going to help you get the residency, especially if you want to do pathology, for example. And then your fourth year, you wrap up everything, and then you start getting ready for applications. You finish your Step 2 and also your CS. And the thing about your CS exam is that you want that after your internal medicine and emergency medicine rotations. I think that's where you get the most direct patient contact. And I would recommend taking it after your CK, because once you know your clinical differential diagnosis, take it from there, and then eventually you get into residency, and then you do a fellowship. So I'm pretty much around here right now. So let's kind of talk about surviving the first year and second year, and then we'll talk about the third year and fourth year and general stuff. So one of the things that you have to understand is you want to treat medical school like a job. So if maybe before medical school you've been working, treat it like a job, meaning work 9 to 5, like that you would any job. And don't take too many breaks. Don't the same thing goes with the job. You don't take too many breaks in the job as well. Have a time. Okay, I'm going to wake up 9 o'clock in the morning, 5 o'clock in the morning, 5 o'clock in the evening, I'm going to be finished with everything. and then I'm gonna take a break after that. Like for example, you need to be consistent. Like every day, pretty much have a plan of action. And the night before, what I would recommend is have your plan set up. Like before you wake up in the morning, or actually at nighttime, just kind of write down your goals, what you're going to be doing the next day. So that'll make it easier for you, so you can actually achieve your goals. And the other thing is that if you do that every day, it's going to make it a little bit easier, because things won't add up. So for example, I'm not sure what's your more typical morning breakfast. Over here, it's typically called, people eat pancakes over here. So if you eat 3 pancakes every day, and you don't let it accumulate, it'll be less stressful on you as well. Okay. The second tip I want to mention is that study to pass an exam before studying to ace it. Okay. So first of all, understand the big major concepts of the information. Don't get into too many details. Understand how things work, and I think that'll make it a little bit easier for you. And then if it's something that it's very detailed, just kind of leave it on the side, but understand the big concepts. And then another important thing is make sure you get the first aid. First aid is a book that they use for USMLE Step 1. I would actually get it early and start using it at an early pace, within your first and second year of medical school. For example, let's say you're in a pathology lecture with one of your teachers. Have that book in front of you, and start making notes on it. And the more familiar you are with that book, the better you'll score at the end. You just want to get used to it, and then it'll just save you stress in the future. And then eventually, you can take like an assessment exam after your first 2 years, and you can dominate on that. Another advice I want to say is just be very careful about advice from others. It might kind of might kind of sound funny, and I'm giving you currently advice right now, but at the end, take everything for what it is. Use it to find out what works for you, because at the end of the day, it's just advice. You hear things, you hear is just whatever you hear is just things are in general, but figure out what works for you. That's what I want to say. Maybe, I don't know, maybe your learning style is different. Figure that out early on, so then you can succeed at the best rate possible. For example, myself, I like to listen. I'm an audio learner, so I try to record everything, and that helps me out. And there's actually a next tip is there's something called a FOMO tip. It's actually the ultimate focus killer. Now, and what FOMO means, basically, it means fear of missing out. It's basically more of it's real in medical school than ever. I mean, for example, let's say you're missing out on something, that there's a conference going on, tomorrow or even that same day, or maybe there's some Facebook thing going on or whatever. Try to avoid those things. Try to just focus on studying your first 2 years, and of course in medical school, because those can really distract you and kind of throw you off focus. I mean, have you ever got on your phone, got on Instagram for just 5 seconds, see whatever anyone else is doing, and then you just get completely distracted? So yeah, try to just limit those things, or just do it after 5 p.m. when you're done with your work. Another thing I just want to make sure is you got to be balanced. So you work hard, you got to play hard mentality is the way to go to medical school. Have fun, hike, maybe play some music, do whatever you want to do. At the end of the, take what I typically do is once a week, I just take the whole day off and just relax, because your mind needs that. And actually will make you stronger at the end. And then other thing is, when you're starting medical school, or when you're going to school, don't compare yourself to others. Just focus on yourself. Some people I've talked to, said that it causes so much anxiety. Don't worry about what anyone else is doing. You really don't know their situation. Just focus on yourself. Don't worry about what anyone is saying. Like, let's say someone's in biochemistry, for example, and they're rambling about some new research and enzyme, and they know 30 things about it. Don't worry about that. Just you do what you need to do. Or someone is just saying all the answers right away. Just you focus on yourself. And also, take care of your body. Make sure you exercise. That's going to keep your mentality sharp and your health really strong. And I'm going to actually get into how to answer questions and so forth in a little bit. but the more questions you do, the better you'll perform. That is something that I kind of learned the hard way. I used to just want to keep reviewing material after material after material and not do questions, but questions is one of the key things to step one. I think I can't remember how many, I probably did over 7,000 questions when I was studying for step one. I think that's helped me out because you see so many various scenarios, and you kind of see how things are tested, and that's really important. And then you'll just be able to just do better overall because you'll be able to see things from different sides, and that's really important. So and don't worry about getting things wrong. Getting things wrong early is a good thing because then you learn more. The more things you miss, you'll actually you remember also. So get as many things wrong early as possible. And then another tip is I want to mention is that I don't think it's on here, but understand the difference between working hard and stressing out. Actually work smart, get advice from, people that have, done the program. What do they do their fourth year? What do they do their third year? And so forth. So those are just some tips that I just want to share that kind of help you succeed during your medical school time. All right. So let's see. Let's go to the next part. All right. So this is just some more things that that everyone can do as a medical student. Know your goals. You might be a third year right now, and you might be thinking, I'm in clinicals right now. What do I need to do? Well, you can start studying for step one. You ask yourself, why are you going into medicine? Do you like to see patients? Do you not like to see patients? And pick a field accordingly. Know your own timeline, and that's the most important thing. Know where you are right now. I think some of these points I've already touched on here. And don't procrastinate. I think don't leave stuff to the last minute. I think if you leave stuff to the last minute, it'll only take a minute. All right. So this is the most important book. Make sure you get the USMLE Step 1. There's so many different concepts on it. It does change a little bit every year, but not that much. Basic science doesn't change that much. Like physiology is not going to all of a sudden change. So, just get it ahead, make some notes in it, and then, whenever you do take the exam, get the updated one and just kind of, just see what the difference is and just add it onto this book. All right, so I want to start with question tips. All right, how to actually answer questions whenever you are actually doing questions. One thing that I like to really emphasize is that think of each question as a real patient. I think if you do that, it'll just make it easier and just kind of have a visualization. Okay, you're seeing a 35-year-old female, you're seeing a 65-year-old female, or 55-year-old man, 2-year-old boy, and so forth. You want to always think of it as a real patient. That'll just make it easier for you down the road. And other thing is look at the big picture of everything. Okay, what, am I looking at a neuro case? Am I looking at a endocrine case? If I'm looking at an acute case in the emergency room, what's going on? Look at the big picture of everything. And also one thing that I'm going to be emphasizing in the class when I start medical terminology is know your terms. Don't skip terms. For example, if you don't know what one definition is, look it up. Don't skip it. Understand that definition. And so then things don't kind of accumulate in the questions, because what typically happens is whenever you answer a question, it could be a concept issue or it could be a somatic issue. Maybe you didn't read it properly, or maybe you just didn't understand the concept, and that's kind of how you break down questions. And also organ systems. Understand the organ system. Is the question coming from the heart? The cardiovascular system. Is it coming from the integumentary system? And so is it coming from nephrology and so forth? So understand based on an organ system. Now, sometimes you'll have to combine things, but kind of understand. Okay, is the patient coming in for respiratory symptoms? Is he or she coughing? What's going on? And also know what a symptom versus a sign is. And this is one of the biggest things that took time for me to understand. Symptoms are basically experienced or observed by the patient. So whenever a patient goes to the doctor because of symptoms, they say they have a headache or nausea or vomiting, and then the physician will listen to the symptoms, which are basically signs to the physician. So basically, observed by the physician, which leads to a definitive diagnosis, is basically is a sign. Okay, so they definitely know that, and I think that'll kind of make things easier for you as well. And then also, whenever you see a question, kind of know the format of the question. We're going to be doing a few questions in a little bit, but know the format. Whenever a question is presented, they start with a history. They have a history of presenting illness. Then they have a physical exam. For example, they check the heart, they check the lungs. Maybe they check the skin and so forth. And then they do labs. They order a TSH. They order a T4. And then imaging comes, and then surgery. So it's usually a typical pattern like this: history, physical exam, labs, imaging, and then surgery. And if you understand that format, whenever you answer questions, that'll just make things a little bit easier, because you'll know what you need to do on the next step. Typically on the step one, they typically will give you history, physical exam, labs. So you'll see imaging as well. Typically they don't do surgery, but then whenever you move on to the other exam, they'll typically have surgery as well. All right, and then other tips I can mention is that, whenever you look at a scenario, is it an acute case? Typically, acute cases are typically less than 4 weeks. Is it a chronic case? Has this patient been having this disease for a long time? Also note the age of the patient. If it's a young patient versus an older patient, that will really give you a big differential diagnosis. It'll definitely change your differential diagnosis. And if something is extremely vague in your question, always go back to your physical exam findings or your lab and imaging description, because a lot of the answers are in the labs and also the physical exam. It might not even be based on the presentation. And also, one thing you want to do is, one thing I've noticed in all these USMLE exam is they give you typically 2 to 3 clues that will lead you toward the answer. Sometimes, and then they'll give you a bunch of distractions as well. But then, if I'd say about 3 to 4 things kind of lean toward one way, and then one thing leans another way, go with the 3 to 4 things that lean one way. Does it make sense? So, if 3 things are going toward, for example, diabetes, I'll pick an answer that says diabetes, and one thing actually says, going toward like something autoimmune. Well, it's probably more likely going to be diabetes. And then also, I think that's all I want to mention right now, because the other stuff is more step 2 related. Okay, so I think let's get started with the first question. And what I'm going to do is I'm going to basically break down the question, and then I'm going to basically talk about the disease within the question, and then we'll go from there. One thing that I typically do is whenever I see a question, so first of all, this is a typical USMLE question that I actually got when I took the USMLE. And they typically have your answer choices at the bottom, and then you have your whole clinical scenario. One thing that I do even before answering the question is I actually scan the choices, just kind of take a quick peek at the choices, to see what's kind of going on. And then I actually also read the last sentence. The way I do it is, okay, what is the most likely diagnosis? And then you always want to rephrase that last sentence. You want to be like, what are they actually asking me right now? And in this case, they're asking for the most likely diagnosis, meaning, what is this disease? What is this disease? So you make it very simple as possible. And then I start with the top, with the last question in mind. I say a 40-year-old woman presents with constipation and severe abdominal pain. Okay, so that's what they're coming in for. She noticed these symptoms for symptoms 6 months ago, but then just said, so this is chronic. It's been going on for a while. Typically greater than a month is more chronic. They've been progressing since then, so they've been getting worse. So that's one thing you always ask whenever you take a history: is it getting worse? Is it getting better? Well, it looks like it's getting worse for her. Her family also noticed changes in her behavior, particular moodiness. So she's having some, maybe some psychiatric stuff going on. Her pain is described as severe burning sensation that is worsened by fasting. Okay. So she's having something, in her stomach, so there's something going on there. And then she's tried over antacids, which really didn't do much. So typically, this could be a GERD type of presentation, but typically GERD will go away with antacids, but it's not really helping her at all. So something else is going on. So then you see the labs over here. And one thing I'll recommend is that if you can memorize certain lab values, that will be very helpful. So then you don't have to keep opening up the lab sheet on the exam. That'll save you a lot of time. So typically in this question, they've given it to you. Sometimes they will give it to you, but sometimes they won't. So you have to memorize. Always memorize sodium, chloride. So it looks like sodium is normal. Chloride is pretty much normal. Potassium is normal as well. Bicarb is pretty much normal. And then now the calcium is increased. So that's something to be aware of. Typically calcium is between 8.5 to 10.2. And then phosphorus is low. So that's kind of important to know as well. Typically when the calcium is increased and the phosphorus is usually low as well. Patients, and then it says patients who undergoes the upper GI endoscopy, which reveals a severe. So they did some imaging. This is your imaging right here. So that's your, and then ulcers represent, okay, so she has ulcers everywhere in the stomach, the duodenum, and the jejunum. So what is your most likely diagnosis? I'm not sure if anyone's answering this, but typically, so this is a MEN syndrome. So this is basically multiple endocrine neoplasia, okay? And that's what I want to talk about today a little bit. And we'll kind of get into which one it is in a second. So basically, whenever they say multiple endocrine neoplasia, multiple means more than two, and neoplasia basically means benign or malignant, okay? And in this case, it's typically going to be malignant, okay? So multiple endocrine neoplasia is a autosomal dominant disease, and what that means is that you only need one inherited bad copy to have a problem in the genes. And so typically this syndrome involves the endocrine system. So you can see over here, these are all the endocrine organs over here. You have your thyroid gland, which basically affects all your metabolism. You have your parathyroid gland. You have your adrenal glands, pituitary, and so forth. So this is your endocrine system, and also your hypothalamus, also your pituitary gland as well, which works with your hypothalamus. So whenever we talk about this syndrome, there's actually three variants to it. So the first one is actually called MEN type 1. MEN type 1 will, in 90% of the patients, will affect the parathyroid gland. And it'll actually increase activity in the parathyroid gland, and it'll cause hyperparathyroidism. And that will eventually lead to increased calcium and eventually lead to stones, specifically calcium oxalate stones. So that's what it typically affects the parathyroid gland, MEN type 1. And then it also affects the pancreas, and specifically the pancreatic islet cells, the beta cells, and the alpha cells. Let me scroll down a little bit. So these cells right here. So in the pancreas, as you're learning through, some of you might not be familiar with this, but the pancreas has beta cells and alpha cells, and the beta cells make insulin, and the alpha cells make glucagon as well. But one other thing that I want to also mention is that this MEN type 1 also basically can cause a gastrinoma in the pancreas as well. And what the patient was experiencing with all this GERD is probably the reason for that. And then eventually that will lead to something called Zollinger-Ellison syndrome, which is basically when the patient has multiple ulcers in different parts of the intestine as well. And then another one, you can actually affect the pancreas and get something called pancreatic neuroendocrine tumors as well. Another system that this MEN 1 affects also is the pituitary gland, and the pituitary gland is of course, in the near the brain area, for example, the cerebellum, and it's right below the hypothalamus, and it's pretty much the size of a pea. And it's really important to understand the pituitary gland because that will help you understand the disease, because anterior pituitary is the one that's affected a lot, and the anterior pituitary is basically where you actually synthesize and secrete the hormones. In the anterior pituitary, you make TSH, ACTH, LH, FSH, and GH and prolactin. And the posterior pituitary is where basically only two hormones are released, which is oxytocin and vasopressin. What is the main difference between the anterior pituitary and the posterior pituitary? So the main difference is basically, so the hypothalamus will basically have a releasing hormone, and the anterior pituitary synthesizes and actually secretes their hormones. That's the most important because, but the posterior pituitary is just stores it and releases the vasopressin and oxytocin. So it's under neural control for the posterior pituitary. So going back to the MEN syndrome, so and then MEN, there's also a MEN2A. MEN2A is also another name. It's called Sippel syndrome, and the most common organ involved in that is the thyroid gland. The thyroid gland is responsible for your metabolism and so many things, but one reason that's really important for that because it actually causes something called medullary thyroid carcinoma, and I want to kind of talk about that now. So medullary thyroid carcinoma accounts for about 5% of the total thyroid cancers in different times. So there's many different types of. The most common one is actually papillary thyroid cancer, and then you have the follicular, and then you have medullary. But it counts for 5%. And there's actually two types: there's a familial type and a sporadic type. In most cases, in 80% of the cases, it's the sporadic one that is actually involved, and typically will happen in patients that are greater than 45 years old. And the way it actually presents, it's very unilateral, and whenever actually they do an FNA, it's typically cold. When you think about cold, think cancer. If it's hot, with the radioactive nucleated scan, it's going to be more likely not cancer, more like a hyperthyroidism state. And it's actually the most common presentation is a solitary thyroid nodule, which is usually typically present in 75 to 95% of the cases. Whenever you look at this tumor, you want to basically know where the tumor cells are coming from. Typically, the thyroid has something called parafollicular cells, and they're typically located in the upper portion of the thyroid lobe. And so that's going to be where most of the tumors are going to be coming from as well. And as in your thyroid gland, you have your right thyroid lobe and you have your left thyroid lobe as well. Actually, you have three lobes. You have your left, you have your isthmus, and then you have your right. You have your right isthmus and your left as well. Let's go to that. So, so I think we answered this question. Why are tumors arising from that region? Tumors are, it's arising from the follicular cells of the thyroid gland. So let's actually get into the histology of this as well. So typically, whenever one thing that I've noticed on the USMLE now these days, they're asking more histological and pathological pictures. So over here you see a picture, of medullary thyroid carcinoma. You can see over here these round polygonal tumor cells, and you see this amyloid stroma as well. And this is typical image of this tumor. It's associated with amyloid, so you typically will order a Congo red stain. And this, by the time this presents in the patient, it'll actually already have been presented. It's already going to be spread through the entire lymphatic system and the blood. So it's pretty poor prognosis by that time, and that's why they typically present with cervical lymphadenopathy and so forth. And the growth pattern is typically solid, and they don't have a capsule. You don't see the capsule here, but they typically don't have a capsule. And most of this tumors derive from the C cells, and then the C cells will basically increase and of course cause amyloid deposition in the surrounding stroma right over here, as you can see. So what is amyloid composed of? So it's typically altered calcitonin secreted by the tumor cells because of C cell hyperplasia. That's the key thing that's responsible. If you see C cell hyperplasia on the exam, go with this. And this is going to help you differentiate from other diseases. You can see over here all these cells are increasing as well. So what is C cell hyperplasia? So that's basically the precursor lesion for medullary thyroid carcinoma. And over here you can see this is typically a thyroid slide as well. You can see this, you can see these clear pink granular cytoplasm over here as well. And then over here you see an immunostain, and that's one thing that we do in our labs. We always order immunostains to figure out which antibody is positive. What it is the antibody will attach to the abnormal cell, and you'll highlight it, and you can see this dark stain over here, which is basically telling you about the immunostain. I think I've ordered like so many of these. So and then there's the familial type of MTC, which is basically autosomal dominant. It typically happens in younger patients less than 35, and it's associated with the syndrome that we're talking about, MEN2A. And typically it's bilateral or unilateral on the thyroid. So like I said earlier, most of this disease is typically already metastasized, and one of the most common areas that metastasize is typically to the bone. And that's where typically it metastasizes to, but it can metastasize to the lung, liver, brain, and skin. And in the lung, it can cause a lot of hoarseness. Especially if it goes to the trachea and then eventually the lung, and a lot of respiratory problems. So it's pretty severe. Now, so the next one is basically, I want to just go back to MEN2A again. So MEN2A, like we said, it has medullary thyroid carcinoma, and it also affects the adrenal gland as well. And in the adrenal gland, it's going to actually cause something called pheochromocytoma, and the parathyroid gland is going to cause hyperparathyroidism as well. So that's basically going to be MEN2 right here. And they might say just MEN2. Instead of MEN2B, they might say that as well. But you should know the terms interchangeably, MEN2A, MEN2B, and so forth. What is the difference between MEN2A and MEN2B? So the difference is that the MEN2A basically has parathyroid tumors, and the MEN2B typically has mucosal tumors. And you can see over here, you can see these mucosal neuromas over here. They typically present. You can see it over here on the tongue as well. And also they can have morphonoid features as well. So they can have lanky fingers and so forth. So that's that question right here. All right, so let's move on to the next question. And one thing that I recommend is whenever you actually do a question, they're going to give you a percentage. So let's say the correct percentage is 50%. Okay, so obviously you're going to look at that choice, but then if the second percentage of the question that was wrong was like 30%, a lot of people were picking that, go through that answer as well, because that's you want to always change. Basically what you want to do is you want to basically see why people pick that answer as well, and then you can learn from that as well. So let's go to the next question. Okay, so next question is another more, it's not the same question, but it's a little bit different. So which of the following sets of serum lab findings would be expected in this patient? All right, so we start again. So you have a 23-year-old female is undergoing evaluation for refractory hypertension. So what does that mean? That basically means that the hypertension is actually not getting better. Okay, so let's see. So her blood pressure remains elevated despite compliance to her interventions, exercise, pharmacotherapy with both amlodipine, and so she's been taking her medications. She's doing exercise, she's doing everything she can, and she's young. So that's a big red flag right there. And then they do an imaging. So the CT scan reveals bilateral adrenal hyperplasia, and then the lab testing reveals elevated levels of aldosterone and decreased levels of renin. So we're thinking more endocrine system, and now that so now they're asking which of the following lab values it is. So you kind of look at your choices here. So which one? Keep your answer, and we'll come back to the answer in a second. So basically, this question involves the adrenal gland. So whenever you look at the adrenal gland, it's superior. It's on the superior pole of the kidney, and the adrenal cortex consists of the zona glomerulosa, the fasciculata, and the reticularis, and of course the medulla right there. So this is the specific organ it's involving right here. So you always want to kind of understand this. And then this is the pathway that we're working with as well, because it's affecting pretty much everything over here. So we're going to kind of get into this as well. So now, specifically, when you go into details of the adrenal cortex, you have your zona glomerulosa, which basically makes aldosterone. You have your fasciculata, which makes the cortisol, and your reticularis, which makes androgen. So we're pretty much focused more on the glomerulosa, because you can see that the renin was decreased in that question, and the aldosterone is most likely increased. It's probably more of a secondary hypertension. And this is something that they can actually present on the exam as well. I've seen questions where, they'll present a scenario like this, and they'll put a histological image, and they'll be like, which area is it most likely involving? Well, you're going to have to pick the glomerulosa, which is more superior here as well. and then this is the capsule as well. You can see the medulla is really important as well, which actually relates to pheochromocytoma. So, and also another system it's involving is the urinary system as well. And specifically, it's involving the distal convoluted tubule because aldosterone affects that. So it's good to also understand, okay, from the nephron, and then you all the way go to the DCT and how each tubule is affected by this system. So we're going to get into detail with that. So, the distal convoluted tubule is mainly responsible to aldosterone and vasopressin as well. So whenever there's a decrease of volume in the system, your aldosterone is going to be increased. And what aldosterone typically does is it will bring in the sodium. It'll bring in one sodium with 3 waters. That's what it'll typically bring in. So it'll basically secrete the potassium and the hydrogen, and that'll increase the blood volume, and then eventually that'll increase the cardiac output and the arterial pressure, and that will decrease renin. What is specific function? So there's increased reabsorption of sodium from the distal renal tubules and excretion of potassium and hydrogen from the distal renal tubules as well. And of course, the water reabsorption is going on, and it acts as a long-term regulator for blood pressure. Now, when you look at the disease, it's Conn syndrome. Okay, so typically, when you go to the gross lab, you'll typically see this very pigmented lesion, which is an adenoma. It's very orange, very very vascular as well. And typically, the features of Conn syndrome include hypertension. You have muscle weakness because you're losing the potassium, and also you're going to have possible paralysis because of the hypokalemia. Potassium is really regulated well in the body. You typically have to be between 3.5 to 5. And also you can get polydipsia and polyuria as well. Whenever you see this, whenever in the scenario you have hypertension with hypokalemia, you want to have a broad differential for your diagnosis, because that's gonna help you out with differentiating other ones as well, which I won't get into all the details right now. So the answer is C, Conn syndrome, and let's move on to the next question. The next question is, which of the following is the correct location of the pheochromocytoma tumor? The patient was given a phenoxybenzamine, which is an alpha blocker, followed by a labetalol to control his hypertension to avoid hypertensive crisis. Due to the severity of the disease, the patient was scheduled for laparotomy to remove the tumor. Okay, so they're given a drug it's an alpha blocker, and also they're given a beta blocker, okay, to control the hypertension, avoid hypertension crisis. So typically, this is the typical management for pheochromocytoma. So typically, pheochromocytoma is going to cause hypertensive crisis. It's a tumor of the adrenal medulla, and the adrenal medulla releases epinephrine and norepinephrine. And the reason they gave this medication first is because you want to first control the symptoms before you do the definitive diagnosis. You want to take care of that patient first. So for example, let's go back to this. So you can see over here that you have your cortex, which we just talked about, and the medulla is basically where you make the norepinephrine and also epinephrine. And that's actually also the test you use to diagnose this disease. Typically use the VMAs for specifically to do that. So it secretes a small amount of dopamine as well. So that's what I want to mention on that one. So I think we're done with that one. So now let's go to another question. So this is a question I remember I got, I think it was my last question I had. So they ask you, what is the most likely diagnosis for this patient? So you have a 44-year-old female that was referred to the dermatologist for lesions on her neck. She has no significant past medical history. On physical exam, you see multiple small 5-millimeter fleshy pedunculated lesions that appear to be hanging from her skin. Few are hyperpigmented, and the patient's stains, they're not painful or itchy, but they just look horrible on her. That's what she says. So what is your most likely diagnosis over here? Okay, so you can see the pedunculated, very fleshy. So the answer over here is actually called acrocordon. Okay, so whenever they bring a typical scenario like that, you got to understand the different terms as well. So acrocordon is also called a fibroepithelial polyp, and typically, it typically will grow outward of the epithelium, It's not like a cyst where it goes inward, but typically it will grow outward with a fibrovascular core. But in terms of clinical features, it's very like a papilloma-like, very round, sticking out. And you typically have multiple lesions of this. So let's kind of get into the histology of this a little bit. So like I said earlier, it's going to be like growing outward, skin lesion over here. It's kind of going to be growing outward. And it's going to look like a finger, like a papilla. And if you think about it, whenever you look at the definition of a papilla, it's basically a fibroepithelial finger with connective tissue lined by epithelium. And that's what's called a fibroepithelial polyp, which is also called a skin tag. So if you look closer here, I'm going to skip a little bit. So if you go to this slide over here, I'm going to go a little closer here. You can kind of see that, you can kind of see the more detailed pictures kind of sticking out and so forth. And it's actually just to talk, it's actually usually associated with diabetes and also viruses. But the key thing that you need to know, it's benign. It's not malignant, and they're typically removed for cosmetic reasons. But you can kind of see, if you look at the skin layers over here, you can see it's kind of like a normal skin, except it's kind of growing outward like a little polyp over here. And if we kind of go through the skin layers, you can see that the first layer over here is your stratum corneum over here, as I highlight this stratum corneum. And then below that is you have your epidermal layer over here. And then below that is you have your basal layer. It's kind of hard to see, but you can kind of see it right here. And then below that, you can kind of see some blood vessels right here, blood vessels, I think this was probably more like a vein over here. This is more of a artery over here. Typically blood vessels are in the dermis, but in this case, it's in the fibroepithelial core as well. So that's important to know. And yeah, I think that's all I have for today. And I thank you for everything. I hope this was very helpful to you. And kind of, I didn't want to go into too many details, but I just want you to understand what you need to do when you're in your first and second year of med school, and also just kind of get an idea of how the questions are going to be. I think you've chose the right program, and we're all there to support you as well. So if you have any questions, please let me know.
So sir, what I can do is I will take up every question now,
Yes.
what students have asked, and we will try to solve them one by one. All right?
Okay. Sure.
Perfect. So we'll start from the start. There are a lot of questions which have come,
Sure.
and we'll try to answer them. So
Okay.
first question, which Priyanka Shaw has asked.
Sure.
She's asking, sir, how is a symptom different from a sign?
Okay. So basically, symptoms are typically experienced by the patient. That's the key thing, or observed by the patient. So, so for example, if you get a headache, that's basically the symptoms that the patient will go to the doctor. Whenever a patient goes to the doctor is because of symptom. But whenever the physician listens to our symptoms, they're actually called a sign. That's what it is. Does that make sense?
Let me see. Priyanka, is your question answered, please? Can you confirm? Yeah, she's saying thank you. She understood. I'll try.
Yeah, that's a key thing.
Perfect.
And also, whenever we start medical terminology, we're going to go through different examples, and I'm going to give you questions on that as well, because most people, I think that's one of the biggest, hardest thing to have, symptom versus sign.
Perfect. Adarsh is asking again an interesting question, sir. You'll find very interesting questions from students. So he's asking, sir, approximately how long one should take to solve a question like these? Whatever questions you discuss, how
Yeah.
much time should it?
Okay. So the USMLE will typically give you around 70 to, I think it's about, don't quote me on it, I think it's like 85 seconds, it might be 70, I have to double check. But you typically want to answer these questions within a minute. Now, the way I was kind of answering this, I was kind of going slow because I just wanted you to understand, what they're talking about. But typically, you want to answer these within a minute. I would say 70 seconds. That's the time they give you for these exams. And the best way you can actually get fast is by, practicing a lot of questions. One thing that I do that's helped me a lot is I actually sometimes I just cover the choices. I look at the scenario and I'm like, okay, I read the whole scenario. Actually, I read the last sentence and don't even look at the answers until I come up with my own differential diagnosis. And that's how I kind of got faster. And also knowing your medical terms is going to it's going to help you become faster as well. So it's going to take time, but I think the more you do, the faster you'll get.
All right. So, Saurav Upadhyay, he's asking, sir, how to study first aid in medical school. So,
Oh, first aid. Okay, that's okay. Great. So what I do is, first of all, I mean, I don't know the entire schedule of the program, but let's say you're starting anatomy. Okay. So what I would do is, let's say your teacher goes through a certain PowerPoint. Let's say they go through tetralogy of Fallot. Let me see if I can. So what you can actually do is you can actually break apart your first aid. So when you open up your first aid, you'll see the content page. I'm going to open mine up just to kind of give you an idea. So you see the content page, and you'll see okay, for example, you'll see the musculoskeleton page, and that's where a lot of the anatomy is. You'll see that, and you'll be like, okay, well, I know my professor is going to be covering this topic, so I'm going to basically open to that topic after he discusses it. So, and then you basically cover each topic like that. But what I typically do is I just kind of make a note of anything that the professor does extra. I put it in my first aid. So for example, if the professor went over seizures, I kind of read his lecture, and then I go to the first aid and be like, okay, this is what the first aid talks about. And then I typically will add like maybe a few points that the professor made that's not in the first aid. And I think that will really help you out a lot. And then, by the time you take your exam, you've already seen this book so many times, it'll be like a quick review of everything. And then you can also, one thing you can actually also do is maybe if you have a book or something, you can always put the page number of the book on the first aid, and you kind of reference that book again to kind of go through the big topic, because the first aid just gives you the high yield information. It doesn't give you all the different details that you might need to know to understand the topic. So just kind of go in by class. So whenever you go through a certain disease, open up the first aid and review what they say on it. Does that answer it, or does that make sense?
yes, sir.
Okay.
So, in fact, a very interesting question now again from one of our students.
Sure.
So, basically, this is based on your experience. She's asking that is it that only US medical school and Caribbean students get matched? Don't you see students from Indian medical schools or other medical colleges also getting matched?
Absolutely, yeah. I can actually, let me see if I can open up something. Okay, so if you look at the website, so I'm just going to go to my website. Okay, okay. So do you see this? Does everyone see this?
We can see that, sir.
Okay, so basically, if you look over here, this is my class. So you can see this person did an MBBS. Okay, so
Perfect. In fact, the Shamanandini was asking about China, and I
yeah,
saw PGY4. There's a student from Nanjing Medical College also getting
exactly. So
this, and Zhejiang as well. Absolutely.
yeah, so
Perfect.
my
Perfect.
classmate, she went to that. So I wouldn't get discouraged, because the thing is this: I'm an IMG as well. Her name is Deborah. She actually went to Christian medical school in Vellore, I think that's so. So people come from different countries. So I wouldn't. So whenever you get to this point, the best way to combat this is, of course, you're starting, your medical school right now. Focus on your step one. That's the most important thing right now. But then eventually, when you get to your clinicals and so forth, figure out which residency will be easier for you to get in. I think that's important, because there's a lot of there's so many residencies out there, and some are actually IMG friendly, meaning international medical group graduate friendly. Because even though I'm from the U.S., but I actually went to a Caribbean medical school, which I'm actually considered an IMG as well. So what I can say is just don't worry too much about that. Just do well on your scores and make some good connections. I think one thing that you need to do is make good connections and get good letters of recommendation. Then you'll be able to match into the specialty of your choice. I hope that answers some of your question.
Yeah, perfect, sir. In fact, that is what we also are trying to, you know, inform them in our every sessions.
Hmm.
Now, sir, I'll just take up another question. But there's a very interesting question I read. All
Okay.
right. So Madhumita Parvati, she's asking, sir,
Mm-hmm.
what is the best strategy to remember the plethora of information,
Ah,
for the USMLE examination? There's
yeah,
too much to learn and too less
yeah.
time. So how do we manage?
Very, very good question, actually. So, remember when I talked about that 9 to 5 schedule I talked about? What you want to do is you want to go back and review some of the things you did the previous year or the previous semester. Even if you spend 20 minutes a day on the stuff that you did learn before, that's going to dramatically help you, because it's pretty much all about repetition. Even if you can, let's say, your first year you take anatomy, histology. I'm not sure what else you take over there, but typically most people take anatomy and histology. Just kind of take a step back and be like, okay, let's just maybe on the weekends, go back to your histology a little bit, go back to your anatomy a little bit. And one thing that you can also add if you have time, because typically in medical school you don't have too much time, you can actually just go back and actually do some questions on the things that you've already done. So let's say your first year you've already covered anatomy and histology and something else, just maybe do a few questions of those every day. And I think that will help you, solidify your material and also help you remember things.
So what I understand is, like, what you're suggesting is take one day at a time,
Yeah.
and plan yourself well. I mean, time
Yeah.
management between the medical school and the USMLE preparation is the essence.
Yeah.
Yeah, yeah,
Exactly. Because sometimes what can happen is, we're just focused on the current exam and so forth, and it's actually tough to kind of go back. But even if you can do 20 minutes of the previous stuff, maybe once a week or twice a week, it's going to dramatically help you, and you will just, you'll just remember so many things. There's a lot of information, but I think anyone can do it if they work hard and if they just manage their time properly and just repeat things that they've done before. Just go back, because the thing is, this stuff that you've done, that you finished with recently, is going to be kind of fresh, and you won't have to actually, like, let's just say, for example, let's say your first year you did anatomy and histology, and now you're in your second year, you pretty much finished all your pathology. Well, you might kind of forget a little bit of your concepts that you learned in histology, anatomy, because you haven't reviewed it. But if you just review a little bit, maybe once a week, you won't forget those concepts. It'll be fresh. And also it'll actually help build onto the next subject as well.
it is perfect, sir. Now, I'm happy that, because the session is focused on the USMLE questions and
Yeah.
academic part of it. So we are answering all the questions related to the study part,
Yeah.
academics.
Yes.
Yeah, other issues like visa or
Yes.
process, everything I will do it separately. All right, so don't worry
Yeah.
about that.
Yeah.
Shannon, now, sir, the question is from Shannon Matthias. He's
Yes.
asking, how do we learn to differentiate different disease, as there are some cases where two disease have similar symptoms.
Okay, that's actually a good question. So, for example, what you want to do to learn to differentiate the diseases is know what it affects the most. I think that's the biggest thing. So, for example, when we talked about men syndrome, men one mainly affects the parathyroid, versus the other one. So, for example, if I go back to men, let me just take an example here. I'm in pathology right now, and the thing about the diseases, like when you actually study the disease in pathology, it actually can affect so many different organs. It can affect pretty much every organ. But what you need to focus on is what diseases are tested, and also what organ system it affects, on for your exam. For example, men 2A actually even affects other organs as well. But in this case, it actually just affects the parathyroid, the thyroid, and also the adrenal medulla. And you can kind of see in these two that these two, for example, they both affect the medullary, the thyroid and the adrenal medulla, but this one doesn't affect that. So I think what you have to pretty much do is you got to find out which organ it affects 90% of the time, and that'll help you differentiate. And another thing is also differentiating by the symptoms it presents. Okay. For example, let's talk about shock a little bit. Whenever someone has anaphylactic shock versus septic shock, you're gonna definitely know the difference, because anaphylactic shock, you typically see a bee sting, versus septic shock, you're gonna have hypotension. So the key thing is just knowing, what's more likely to be affected in the organs, or which organ will be affected more. That's what I would say. Um, and also knowing the organ system. And it's going to take some time. I think there's no easy way to do it, but I think when you go through each system, and you identify, let's say, the thyroid, and the thyroid has multiple, for example, the thyroid has so many different cancers, and you got to know like which specific symptoms that each tumor has, and also you got to know like how it actually looks on histology as well. But there's not an easy way to do it, but you just got to basically kind of make a list and kind of go by each organ system and study, because I think if you just memorize each thing, it's going to be much difficult. What I would actually do is I would actually just understand the concept, of each disease and know how each disease happens. I think that will make it a little bit easier for you in the long run, rather than just memorizing this. Is okay, ask like, okay, why is this disease happening? And I think if you understand why this disease is happening, you'll eventually be able to connect everything. It'll just make it much easier, because if you know why it's happening, you'll be able to know how the patients, how they're going to present and so forth. Yeah. Does that sort of help a little bit?
Perfect, sir. So now, there's a question from Asta. She is in a second year med school, and
Yes.
she's saying that since she's learning the pathology subject in her medical school, so
Yes.
how does she, what are the tips to improve and keep in mind, things important from the USMLE point of view? Like already
Okay.
she's studying in a med school, but for USMLE, how important is pathology and what are the tips to
Yeah.
study?
Okay. So in terms of if you talk about pathology and the way the exam is going now, is I would actually open up something called pathology outlines, and look at each of the imaging, specifically the histological imaging for, like, for example, if you see Hashimoto's, open up a histological imaging for that, see how that looks. And I think that will help you save time on those questions as well, specifically for pathology. So I'm not sure exactly where you are in your studying right now, but let's say, you do a question on, I don't know, let's say, I'm trying to think, maybe, let's say like pheochromosomal, not pheochromosomal, but let's say maybe some adrenal adenoma, like Conn syndrome, for example. Kind of look it up, in the pathology outlines, and kind of see how it looks, and they'll just make it easier for you, because I don't know, for some reason they're just putting so many much more images these days than before. And another thing I can just tell you in general is, for example, like whenever you do more questions, do a lot of pathology questions. I think that will kind of help you out as well. And then kind of whenever you do the question, kind of know how to answer it. So for example, actually, if you really want to know, like whenever you do the question, the first two and the last two part of the question, like the first, like, let me go back to one of the questions. I can show you, give you an example. So for example, let me find a question. The first two and the last two will give you the answer. So the 40-year-old woman presents with constipation, severe burning, and then she noticed symptoms for 6 months. And then the last two, ulcers present in the stomach, duodenum, and also she had some GI disease. So those typically will give you, your differential and your answer right away. So if you can kind of focus on those two, that'll help you a lot too while you're studying. But one thing I could just overall say is have a plan. For example, let's say you're spending time on pathology, write down exactly how much time you're going to spend on pathology. Like, for example, I'm going to do hematology for 2 hours. I'm going to do respiratory for 2 hours, and so forth. Have that timeline set out for you. And one thing that, as teachers will do is we can actually create an individual plan for each student. So then you kind of know where you need to go. And one thing that you can actually do, if you're already done with your second year, you can actually take something called an assessment, called an NBME assessment, to kind of gauge where you are in your studying. So then you can kind of see which areas are weak or not, and then you can kind of go from there. Does that make sense?
Absolutely. So, sir, there are many questions where students are asking that how do they study from first year? For them, let me tell you,
Sure.
on the Moksh platform, we have all international faculties, including Dr. Piyush, to be part of our platform, and they will be teaching you, nurturing you, do your assessment
Yes.
right up to you appear your step one examination.
Yes. And I think, yeah, that's something absolutely. We're going to be, assessing your step one, because we want to make sure you have the highest score possible. One thing that you have to do is you have to learn how to pass the test before you get the high score. So that's really important. And one thing that we will do is we'll make an individual plan. But right now, what you can actually do is get the first aid and kind of correlate it with all the with your subject areas that you'll be studying. But you got to understand the concepts first. If you don't understand the concepts and if you just jump to the first aid, that's not going to be helpful.
Absolutely, sir. In fact, that is what our pre-med students are focusing on, concept building.
Concepts, yeah.
And
Focus on the concepts.
so we are, in fact, very much partners with First Aid team. So a lot
Oh,
of content we are, going to have shared on our platform as well. So
mhm.
absolute support will be provided to all our students. So
Yeah.
now, one personal question from Falguni Patel. She's asking, sir, what should be the mindset while attempting the question? How did you manage pressure during your step one examination?
Oh, yeah, yeah, yeah. Okay. So, one thing that, you want to be, you don't want one question to put you down. I think that's one of the biggest things. Sometimes we see a question, we're like, oh my God, this is so big, or this is so long, or this is so tough. Don't let that affect you. Think of each question, like I said earlier, as a patient. And then if you don't understand that question, if you just don't get it, just move on to the next question. There's other people to take care of. That's what you want to always have. So, and one thing you want to do is when you do questions, don't think about the previous question that you just did. You're not going to be able to get every single question right. Not every question, is the same, and or you can say the same level. So you want to basically have that mindset, like, and the thing is this, like, this will happen with time. For example, when you actually start studying for USMLE, one thing you want to do is you want to do your questions in a time mode. Well, initially you do it on time, and then eventually you do a time mode. And you basically, have a plan. Like what I typically do is when I tell people to study is I tell people to, do 2 blocks of questions in the morning. And you time yourself. You get up in the morning, 6 o'clock in the morning, or 7 o'clock, or whatever time you get up. You get your timer. The question, actually, the USMLE UWorld, they're already going to have a timer in place. What you're going to do is you're just going to get up in the morning. You're going to basically, do your 40 questions, and then you're going to take a break, and then you're going to do the next 40 questions. So typically, it's more of just, working on your concepts and your knowledge first, and then working through the questions eventually. But that's kind of the final stage of your studying. But I think right now what you should probably just do is, if you're just starting studying, is just focus on the concepts, and then eventually get into questions after you've done your understanding your concepts, because then you're going to be very frustrated, in the first place.
Sir, in fact, there are questions related to content to be utilized. So I'm telling you, the
Content,
Moksh
okay.
platform will have one common, you can say we are like Uber. So all the contents, whatever relevant from the step one point of view
Mhm.
and have been recommended by faculties, will be available for all the students. So you don't
They will
have
be
to
okay.
separately access. Absolutely. So UWorld team already is in touch with us, and so
Mhm.
everything relevant to step one will be offered. No problem at all.
Yeah, that's great. Yeah,
Uh,
that's important. Yeah, I think the program will offer you everything you need to succeed in step one, so I wouldn't stress.
Absolutely. So now there are two questions which are similar, one by Nashra Ansari and Akshaya Reddy.
Sure.
She says, how much time daily should we take out of our schedule for step one? Akshaya also saying the
Well,
same thing, a study of how
actually,
many hours per day?
okay. Now this depends. If you're just starting with your medical school, then you're pretty much going to be correlating, with your first aid anyway. But it depends, because, for example, if you're just starting to learn the material right now, you should just focus on learning the material and then going to the first aid, to kind of see what they're saying as well and understand those concepts. So it's actually, you're doing it together. It's not like you're spending, okay, a separate time doing it. Actually, you're just kind of if you make a plan, you can actually do it all together while you're studying in med school. But if let's say you're done with your first and second year of medical school, then you typically need about you'd need to spend at least 6 hours, per day, because you're not going to med school anymore. As if I'm correct, while you're studying, I think you need to spend at least 6-7 hours a day on doing questions. Especially when you're closer to your exam, because you want to basically get to the end of that mindset, and you want to build a stamina. That's the most important thing for this exam, because you can have all the knowledge and everything, but if you don't have the stamina, then you can run into some problems as well. But yeah, if you're just starting out, like I said, just correlate all your material that you'll be learning in this program with your books that you'll be getting. But if you're done with the first 2 years already, then you need to be spending an additional 6 to 7 hours per day. Specifically, if you can do it in the morning, that's better. If you can't, then just do it in the evening on the USMLE Step 1. And we can go into details on how to exactly study and stuff later on, but typically what I typically do is I start with a system-based approach, meaning I go through each system first, and then after I'm done with each system, I start doing the questions system by system, and then I mix everything up toward the end. And then also the NBMEs are going to be coming in place as well. You got to take an NBME every 6 weeks once you're done with your study.
Absolutely, sir. In fact, that is the idea. We are recommending all the students of Moksh, they'll be appearing the subject NBMEs as well as the final NBMEs.
Okay, good. And that's important, actually. That's a great point you made, Chirag, because those subject NBMEs are going to tell you exactly what you need to work on in each area. And I think you should take those seriously, actually. Those are really good. And if you have access to that, that's really good, actually. So, and what you can actually do is whenever you're reviewing for your subject NBMEs, see, that's everything you're doing is pretty much you're studying for USMLE. So what you can actually do is you can review your first aid pathology. For example, if you're taking the pathology subject NBME, you can actually review that as well, and that'll help you score higher on those.
So now, again, there are because we have huge number of students, so there are a lot of questions. So
Sure.
I'm just picking out whatever interesting or
Sure.
So now, okay, so Pooja has a very interesting question. So
Sure.
uh, I understand by the time we appear for exam, we are well prepared. But
Yes.
God forbid there appears a question which we have no clue. How do we solve or deal with that situation where you see a question and you absolutely have no idea how to answer?
That's a I like that question. So if you have so this is what it is. So whenever you read a question, and if you've read the question like 2-3 times, I would just pick an answer. So what I typically do is if I have no idea at all, my favorite letter is A. I click it and move on, because timing is really vital for your exam. You don't want to be spending 3-4 minutes on one question and then end up wasting time at the end. And one tip I'll say is that typically for USMLE, I've noticed that for some reason the easier questions are toward the end. So what I typically do is I actually start with the last 10. I start with number 30 and I go down, and then I go back up. I've just noticed that over the years for some reason. So I would actually do that. So if you have no idea, you just pick an answer, because it doesn't matter how many times you read it, you're not going to get the right answer. And if you try to think, and other thing is I can mention is that if you go into a scenario and if you think like, oh well, it's probably this, but I'm not 200% sure, I probably wouldn't go with that answer, actually, because you might end up getting it wrong. Or actually, no, what I mean is don't make up things on the exam, or don't add things to the scenario. That's what I mean. So for example, if there's something that's not in the scenario, don't start adding from your own self things that are not there, because they'll make you get the question wrong. So does that answer your question?
In fact, for some reason, many students who have attended my session, they are already aware, but still there are new students as well. So all of them, in fact, I saw about 7-8 of them are asking the same question. Does
Okay.
USMLE has any negative markings?
Negative markings, what do you mean by that?
So if the answer is wrong, do they deduct any points? Actually, they don't, but that is
Actually,
the question. Yeah.
I think I think each question has a certain waypoint, so you want to answer all questions. That's what I can tell you. You basically want.
So
I rather you
technically,
answer. It's not like the
there is
MCAT. It's not like the
yeah
MCAT.
it's not like the MCAT or any Indian examination,
No,
especially in the
every.
Indian NEET. If your answer is right, it's +4. If it's wrong, -1. Here
Yeah.
it's more of a scale-based examination.
Yes.
Scale between 140 to 80.
Exactly.
So yeah.
And that's important, because the thing about this exam is that let's say you have 10 seconds left, or let's say you have 10 seconds left and you still have 5 questions left. Go ahead and just pick. So what you need to do in that case is, what I would do, let's say you have 5 questions left on the exam, I would actually just pick A rather than A, B, C, D, F, or whatever it is. because you're more likely to get that, there's probably going to be 2-3 A answers, rather than just skipping things. Does that make sense?
Kind of a personal profile question, but maybe in a brief, if you could also let us know, because there are students who've been asking, what were those points, in terms of your CV, whether it was research, what was it that actually helped you in the match?
Okay. Yeah. I think the thing that really helped me is the rotations. I think that's what really helped me in my letters of recommendation. Of course, the scores obviously help, but I think my main thing, I think my step 2 score helped me more than the step 1, I would say, in my case, I would say. But I think in terms of my overall CV helped a lot, because what I actually did is I did a lot of rotations in areas that, so for example, I did a lot of path rotations because I was focused on path. Not completely focused on path, but I would say I did several. I can't remember, I think it was 8 weeks of pathology. So then when I applied to pathology, I actually got about 2 letters of recommendation from the different pathologists. So that really helps. So if you're going for internal medicine, you want to get the right letters of recommendation for each one. I don't know how the clerkship works over there, but you want to try to get letters of recommendation from program directors, from people that are kind of highly regarded. That's important. Mm-hmm.
To add to it, so Moksh offers this module, it's
Yeah.
a modular program, right? So
Yeah.
our module 3 offers clerkship. So we are partnered with ACGME hospitals in the US,
Oh,
where
you
we
are.
offer them clinical rotations as well. Absolutely. So
Okay, that is
that,
great.
again, the
So
support will be provided by the Moksh team itself.
that is amazing. So I think the way you need to take advantage of that is, if there's a hospital or even a clinic that that the program offers, that's associated with a residency, or even if the doctor knows a residency, go to that rotation actually. And I think that will kind of help you out a lot. And make good connections when you're on rotations. Make some good connections. Talk to the faculty. Don't be too shy. See if you can do more. If you can, maybe if you can do something extra, they love to do that. And one thing I would advise is, make sure you learn your English really well. I think that will help you a lot as well, because that's one thing they grade you on, or that's one thing they like to talk about in your letters of recommendation as well. So just do the best you can. Be interactive. Don't be over interactive, but just be interactive. Listen. Be observant. Don't show up late. Stay. It's better to actually get there early and stay late if you can. They'll show commitment, and they'll definitely help you out with your whole process. But right now I would say just focus on your USMLEs. That's my main focus, my main emphasis, especially step 1. Focus on step 1. Yeah.
In fact, now there's a question which I would like to answer. So there's a student, who is asking whether you will be associated in terms of teaching with Moksh or not. So absolutely. So sir
Yes.
will be teaching initially medical terminologies, and then of course he will be taking USMLE style questions, tutorials for you. Absolutely. So
Absolutely.
she
Yeah.
will be yeah. Yes,
We'll
sir.
definitely
Yeah.
have a plan for that. Thank you.
Sir will be definitely on board with Moksh, so he'll be
Hmm.
while he's of course pursuing his own commitments, he's
Yeah.
agreed to be share the knowledge, and will be assisting Moksh students with the medical terminology as well as the USMLE style question tutorials. Absolutely.
Yeah, knowing
Yeah.
terminology is really important. You got to know your basic terminology, because that's going to really help you out with your basics. You know, I don't want everyone to get overwhelmed with everything. Just start slow, Don't start, getting everything all at once. Just take it step by step. You'll be fine, Just take it step by step.
So in terms of patho as a subject, of course, I mean everybody knows, but Robbins, but
Yeah,
which standard book should I follow for pathology? I'm going to
pathology.
start my MBBS journey next month.
Okay. So for pathology, Robbins, I would say, is the gold standard. I think everyone knows about that. But there's also like a book. I think I might have it on my desk somewhere. it's more of like it's a shorter version of Robbins to help you understand the concepts. Let me see if I have it on my desk. I think the book that I always recommend for if you're just learning pathology for the first time is actually the Robbins Basic Pathology. I think that's the one you want to start out with. I mean, you can jump to the other one also, but if just for understanding the basic pathology, I think it's really good actually. It kind of explains more in detail on some of the basic concepts. And I think that's something important. And then, of course, you can always try high yield books after you do that, like Golgi or First Aid or so forth. But yeah, I think that's the main standard I would recommend. And of course, you want to look at images. I think images is one of the biggest things. Actually, well, let me mention one thing. Make sure you know some of your histology. Find like a very basic histology book before you get into pathology. I think that'll definitely help you a lot. And if you want to become a pathologist in the future, that'll help you tremendously.
All right. So now, students, since you've been asking for all the subjects, well, I'll tell you, visit the moksh16.com and we put up all the list of recommended books. So,
Okay, good.
it's not possible, sir would answer the recommended books for each and every subject, due
Yeah,
to the time
yeah,
constraints. Yeah.
yeah. Each
Yeah.
subject depend. You have to. It depends on. I mean, I would have to look at the list, and I can maybe make some recommendations. I can do that.
Yeah, so we already have it on our platform. So if you go on the
Okay.
moksh16.com, we already
Okay.
have a recommended book list with us, sir.
Great.
All
Okay.
right, sir. So let me see any other question which is relevant and important from today's session quickly. I would like to take that up. So there are so many questions. So it's just that I don't want to. I want to ensure everybody gets one opportunity to ask the question.
Yeah.
I'm just trying to see a unique
Also,
question.
like, one thing that if you want to do, I can always, uh, I can always send you back like a big response to a lot of questions that are unanswered today. I don't mind doing that.
Perfect, perfect.
I can do
So
that too.
we'll work out. No problem, sir. I understand that. Thank you for offering that as well.
Yeah, I
All
don't
right.
mind.
So now, okay. So there's a very short question by Urvashi. Are previous year's question repeated in the actual examination?
Okay. Well, I will say for step one, typically not. One the way they do it. I'm not saying that. I'm not gonna say that the concept is not going to repeat. I mean, they'll probably have a similar question on, for example, Hashimoto's. But they might test in a different way. But typically, in terms of step one, I've not seen too many repetitive questions. On some of the other exams, I have seen a few repeating questions for sure. One thing that definitely repeats a lot is some of the NBME questions. I have seen like some questions from the assessments repeat. I'll say that. Also, for the other exams, for step three, I've seen some questions repeat, especially for the CCS portion. I've definitely seen a few repeat for that. But I wouldn't rely on that because what they have like 33,000 questions, and then every month, they keep using from that bag, and whatever's used, they eliminate those, and just so basically every exam is going to be different. So let's say you take the exam together, it's going to be completely different from the previous one. So yeah, I would say that.
Perfect, sir. Thank you, sir. In fact, I mean, again, there's, I think if they attend the session, it will be, I'm sure they'll understand. But the question is histology, how to differentiate the intricacies in histology slides.
Oh, okay. So one thing that so whenever you look at a histological slide, you want to basically look at the background. You want to look at the different cells. You want to basically look at what. Well, first of all, you want to look at you want to figure out what organ system you're in. That's the biggest thing whenever you look at a histology slide. And then, one thing about histology slides is you have to understand, histology versus pathology. You have to understand what's normal. If you don't know what's normal, then, pathology, it just won't even make any sense. And one thing that I typically do is I try to look at it like in a 3D view. I think that helps me a lot. I also kind of, but for example, if I'm looking at a skin layer, let me see if I can open up something. Let me open up this example that we just looked at earlier. So if you look at this, for example, you want to basically, obviously know where you want to find the normal. That's the biggest thing you want to do. You want to find the normal, and then you want to find the abnormal. That's what I typically will do. And then I think the biggest thing that takes practice is what I typically do is I have to look at multiple different slides of the same diagnosis. That actually helps me a lot. So then I could kind of see it in different ways. And then you want to basically look at the main part of it. So the main part is typically right in the middle of it, and go from there. So, but it depends on each system. If I'm looking at GI cells, for example, if I'm looking at the stomach, I'm looking at parietal cells, I'm looking at oxenic cells, and so forth. If I'm looking at, for example, the skin, I'm obviously looking at each layer of each part, and I think that helps me a lot. I hope that answers your question a little bit?
Sir, absolutely. Now, all right. So, sir, I think there are like again very so many questions, but then many of them I think
Yeah,
students who understand this. The idea for the session today was to discuss the studies from academic point of view.
yeah,
Those who have questions relating the pathway, process, clerkships,
yeah,
residency match.
yeah,
We do sessions every Tuesday. I take the sessions every Tuesday, and you're welcome to attend
yeah,
those webinars where we'll discuss the basic process. Sir
yeah.
basically can answer
Sure,
all the questions
I can
pertaining
answer
to
that.
academic.
Yeah,
Yeah.
in terms of residency process, I can definitely answer that. So the
Mhm.
thing about residency is, I think first of all, since like we know where I went back to the big picture, kind of know that big picture. But what you typically are going to be doing is you're going to be applying to something called ERAS, and I think around actually it already started now. Every June, July, the ERAS portal opens up. So you need to basically get all your registration ready, get all your letters of recommendation ready, have all your USMLE steps in. I mean, especially from coming from international, what I would recommend is trying to take all the steps as much, if you can take step 1, 2, and 3, that'd be better. And one thing I can say about step 3 is if you can take that before residency, it will help you so much actually. Like I mean I kind of made the mistake of taking it during residency, but if I had taken it before residency, I think it would have been less stressful. I'll say the least. um, so try to do those exams before that, but in terms of the process, understand, get your letters of recommendation ready, make sure you do well on your USMLE scores. um, have everything prepared early because September 15th is when the portal opens. And by September 15th, you want to have everything ready, everything submitted. Also, I'm not sure how the program works with Moksh, but, have your programs that you want to apply to. Maybe there's a list of programs you can apply to, have all that ready. And there's going to be some investment, each application does cost money, so have that prepared as well. So there's a lot of preparation for that, and we can go into details maybe on another session or something like that for more of that.
Perfect. Sounds good, sir. So thank you very much, sir. On a Saturday morning,
Yeah.
you happen to be available for the students.
Yes.
So thank you very much for enlightening students about the overall process and the USMLE approach to the questions.
Yeah.
I highly appreciate, and on behalf of the MOOC students and the MOOC team, I would like to thank you to being present, and I definitely hope that we could see you very soon on our live sessions as well, sir.
Okay. Well, thank
So
you.
yeah,
Thank you for having me. And if you have any questions, just email Chirag and I can get back to you on that. And just enjoy your day, and we'll talk to you all soon. Thank you.
perfect. So sir, just for about 2 minutes, there are a lot of students who want to thank and they really enjoyed the session. So Mukul Doshi is saying thank you for your time, sir. So he's thanking you. So I mean, there are a lot of students who are thanking you for the session. They really liked your session. So
Well, thank you.
So Vidushi is saying thank you from Shivam Mishra. So they really enjoyed the session, and all of them want to, just congratulate you for the session, sir. Thank you,
Thank you so
thank you.
much. I enjoy doing it. I appreciate you having me.
Perfect, sir. Thank you very much, and I look forward to see you in the future sessions.
Absolutely,
Thank
yeah.
you, students, and thank you, students. Have a great weekend. And we hope to see you very soon in one of our Moksh offices very soon. Thank you, students, and thank you, Dr. Shuni. Thank you,
Thank
sir.
you.
Thank you.